Early signs of diabetes. Frequent urination. When you're visiting the bathroom more often than usual, it can mean that your kidneys are trying to eliminate excess sugar from your blood. Extreme thirst. You lose a lot of water when you're using the restroom all the time. That can lead to dehydration and trigger feelings of excessive thirst, which will likely lead to drinking more fluids and going to the bathroom more. Dry mouth or dry skin. Dehydration can make your mouth feel like a desert and make your skin feel tight or itchy. Fatigue or weakness. Extreme weakness, lethargy, or sleepiness can be signs that your blood sugar is out of whack. This can cause dizziness, or even fainting, if your blood sugar becomes dangerously high or low. Some people become so weak that they lose consciousness and are unable to regain consciousness again. This is sometimes referred to as a diabetic coma, and it can be a life-threatening complication. Increased appetite or unexplained weight loss. If your body is unable to get enough energy from processing the sugar in the food that you're eating, you may notice an unusual increase in your appetite or even sudden and unexplained weight loss. Slow healing cuts. High blood sugar levels can stiffen your blood vessels, which makes it harder for blood to move around your body. Poor circulation means that little scratches or sores heal more slowly. Yeast infections. Yeast feeds on sugar. When there's too much glucose circulating in your body, it can cause an overgrowth of yeast, for men and women. Pain or numbness in extremities. Nerve damage occurs in diabetic patients, due to high blood sugar and higher levels of fat. That can cause nerve damage, also known as diabetic neuropathy. You might notice tingling in your hands and feet. Nerve damage can also affect internal organs, such as your bladder. Vision changes. Changes in eyesight can be a precursor to diabetic eye disease. Untreated diabetes, or poorly managed diabetes, can lead to problems with vision, and even blindness. Fruity, or sweet-smelling breath. When your body is trying to eliminate excess sugar, it can make your breath smell sweet because of high ketones. Normally, the body uses insulin to help muscle and fat cells take up glucose, a type of sugar, to use as energy. When you develop diabetes, your body stops using insulin effectively, which allows sugar to build up in your bloodstream. Here are different types of diabetes. Type 1 diabetes occurs when your pancreas fails to produce insulin. The immune system destroys the cells that produce it. Previously known as juvenile diabetes, it can occur at any age. Type 2 diabetes occurs when your cells do not respond as well to insulin as they should, and additional insulin is required to achieve the same effect as before, Dr. Weitzner explains. It mainly affects adults. Prediabetes occurs when your blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. Gestational diabetes occurs when a pregnant woman's hormones affect her ability to produce enough insulin for her body. Around 7% of women develop gestational diabetes.